Hi, and welcome to the VDEV CPR Breast Seminar. We're very happy to welcome Ach Adhvaryu. Ach is the Tata Chancellor's Endowed Professor of Economics at the UCSD School of Public Policy and Strategy, Global Policy and Strategy, and the inaugural director of the 21st Century India Center. This seminar will run for 1 hour. The last 15 minutes will be for live Q&A. During the talk, please write down your questions in the Q&A section. Ach's co-authors, Sowmya Dhanaraj, is here, so she can answer some of your questions in the chat. We'll also make a couple of pauses during the talk, and I'll pass on some of your questions to the speaker. Please note you can vote up the questions in the Q&A to make sure those questions get covered. In the final 15 minutes, you can directly ask any lingering questions to the speaker. Just raise your hand and we will open up your microphone. Finally, Ach has kindly agreed to having a post-webinar conversation with the attendees. This will be right after the seminar, and we will post the Zoom link in the chat. Ach, the floor is now yours.
Okay, wonderful. Let's see if I can reshare these slides. Did that work? Okay.
Yeah.
Well, thank you so much for the invitation to present this work. Really looking forward to getting feedback. We're at a very early stage of presentation for this work, so excited to incorporate your thoughts. This is joint work with Sowmya Dhanaraj, who is here, as well as Apoorv Somanchi, who is here, I believe. And special thanks to them for leading this project from the Good Business Lab side. Did an amazing job in all facets of this project. So very, very grateful to have them on the co-author team. And we also have Smit, Gade, and Anant, Nyshadham. So this project is titled The Economic Impacts of Earned Wage Access for Low-Income Workers. Let me give you a little bit of background on this area. There's a lot of work in many low-income contexts related to the liquidity constraints that many low-income workers face. Even workers, this has been very highly investigated in the agricultural worker area. But even low-income individuals who have fairly consistent income streams, like those who are formally employed, often face financial insecurity due to unpredictable and volatile consumption needs. So this kind of arises because of a nexus of problems. Low-income individuals often face large expenditure shocks, for example, for healthcare after illnesses in the family, from social pressures to lend to family members when they have needs, etc. And these shocks are common as well as large. Tight budgets leave little room for unexpected or irregular spending, and these individuals tend to have minimal precautionary savings and liquid assets that they can use for such events. So often individuals turn to credit to solve these consumption needs. And this leads to a reliance on costly informal loans from moneylenders or family and friends. This has been well documented, and in particular, Supreet and co-authors' recent paper on this takes a really close-up look at the kind of financial distress, the psychological distress that this financial stress can cause. Low-income women in particular experience this phenomenon acutely. And this is because relative to men, low-income women often have less agency in household financial decisions. They have lower access to emergency funds. For example, savings committed to ROSCAs might be inaccessible during emergencies. They have smaller informal financial networks than men. And they actually face a greater variety of potential expenditure shock categories. And we see this borne out in our data as well when we asked at baseline about the categories of financial stressors that the women in our study face. Um, Workers in this situation kind of often have to reduce their food expenses or skip doctor's visits. They have to miss bill payments or loan repayments. Um, they have to reduce their transport costs and other types of costs, skip family functions, skip personal or child-related expenses. Um, and this in turn leads to a lot of financial distress. And so when asked about, whether this is a cause for concern or worry, a lot of workers said that these problems in their financial lives affect their health, their routine, their relationships, and even their workplace functioning. So employer-enabled digital financial services might be alleviate a part of this problem. We've seen digital financial services play a role in financial resilience in other areas. For example, um, you know, uh, digital payments and digital transfers across individuals um, through mobile money can provide liquidity during shocks, can promote savings, can enable consumption smoothing. But there's still a lot of gender disparity in mobile phone ownership and usage, as well as financial and digital literacy. So potentially to serve this particular population of low-income women, employer-enabled digital financial services may be a way to overcome some of the kind of structural barriers that still exist. So, in particular, offering digital financial services through workplaces could help in kind of on-site access to easy access to devices, as well as training and support, and lead to better financial outcomes that potentially affect the financial well-being of low-income individuals, as well as trickle down into workplace outcomes. And so to test this hypothesis, we designed and piloted via a randomized controlled trial an earned wage access application, which essentially provided female garment workers um, uh, the ability to withdraw 50% of their earned wages up to 3 times in every month. I'm going to go ahead and describe this, a research question, et cetera, in a second and talk about the results in snapshot. Maybe this is one of those moments where I can stop for a second and see if there are any questions, clarification on the kind of motivation before I move on.
I think you can continue on.
Sounds good. Okay. So the key research questions then we study are whether the provision of EWA or earned wage access between paychecks for workers, in particular women workers, can reduce the reliance on informal borrowing and smooth consumption, reduce financial stress and improve savings, improve workplace outcomes like retention at the firm and productivity, thereby sort of making the business case for the adoption of such interventions in workplaces, as well as empower women by improving their overall earnings, self-efficacy, and intra-household decision making. A quick snapshot of the results that follow. Uh, a lot of women tried the app in our 1 year trial period, and many women made repeated transactions in a given month. Um, these users tended to be people who were higher financial distress and who used informal borrowing more. Um, the main treatment effects on financial outcomes were pretty substantial. A large reduction in informal borrowing from among this treatment group, improved self-reported liquidity, and importantly, improved workplace outcomes, including a large reduction in turnover, as well as an increase in productivity. We're going to put those things sort of in context and give you some magnitudes as we go along. Okay. All right. So let me move on to the context now. As I mentioned, we're going to focus on uh, women who are employed at a garment firm. In case you all thought I was done doing papers on the garment industry, you would be mistaken. Um, all workers receive wages in this context monthly at the seventh date of the month through direct transfers to their individual checking accounts. And we're able to track worker attendance and um, uh, turnover through biometric authentication that's integrated into a payroll system. And we designed basically an early wage processing system uh, that allowed workers to withdraw some of their earned wages before their paycheck. Okay, let me tell you about the design of the intervention. Um, we worked in one factory. Um, Women who were meeting the eligibility criteria of being ever married and who were working at the factory for at least 6 months, so for a bit of stability in our study sample, were randomized into groups using a stratified randomization procedure. We ended up with about 400 workers in the treated and control group. So a bit on the intervention. We designed through a lot of sort of on-the-ground scoping and qualitative work and piloting an earned wage access platform through the design and technology and research teams at Good Business Lab. The platform allows workers to withdraw up to 50% of their earned wages at any time during the month before their pay period is over. And when they withdraw this amount, it's transferred directly into the same checking account that the worker uses for their payments for their regular wages. Um, Earned wages are calculated based on the worker's monthly take-home salary up to any specific date. And it's calculated based solely on the number of days that the worker worked during that period. So this doesn't account for things like overtime, productivity bonuses, etc., which are not sort of immediately integrated into the platform. Those things workers still get, on the regular pay period. We allowed for 3 maximum withdrawals per month. Um, and the way that this works on the back end is that these withdrawals are then integrated into the factory's payroll systems and are marked as deductions from their salary in the next pay cycle. I should mention that, some of these restrictions, including withdrawing only up to, a certain amount of the earned wages that were available, were made, to essentially to mollify the factory management, who was, at the start not very enthusiastic about this program. Their hypothesis was uniformly that workers would take the money and run essentially in the middle of the month, and so they wanted to limit how often you could do this and the extent of money that you could withdraw. Um, and so this was the sort of compromise we reached with factory management to be able to implement, access to the earned wages early. As you can see, kind of we have these tablets located on the shop floor, and this was meant to sort of reduce barriers to access. So this wasn't an app that workers had to download on their phone and link into their sort of financial accounts, etc. This was rather a service that was available to all workers in the factory, who are part of the study, and meant to be implemented in as an easy as way as possible to enable greater access. Here's a few snapshots from the app. Essentially, workers. We also had an individual manning each of these each of these tablets to be able to assist the worker if they had questions during this kind of withdrawal process. So at any point during the day, so this was often done, at lunchtime when workers had a bit of free time outside of their production line. Workers approach the tablet. They log in using their employee code or QR. Um, they can check their earned salary balance, and from that amount, they are able to withdraw a certain amount. We made that clear how much they were able to withdraw, and then we essentially had them type in the amount that they would like to withdraw from that available amount. Um, and then once that request was submitted, it took a little bit of processing time for the money to actually show up in the worker's account. This was usually a day or less. So the way that this worked was that treated workers were provided with access to the platform via individual employee code-based registrations, and control workers had kind of business as usual, with their salaries being directly transferred to their bank accounts on the 7th of every month. We used a variety of different data sources, including some surveys that we did at baseline and endline, as well as up to three times during the intervention period, which was about a year. We also had data from the app, which is, of course, only available to the treatment group. And we had data from the firm's administrative records on things like attendance, compensation, and turnover. We did this work across the course of about a year. And as you'll see by these dates, this trial only recently finished up. This might be the quickest I've ever gone from a trial finishing to a draft of a working paper and results being done. And I have only Sowmya and Apoorv and Smit to thank for that. So thank you very much for for that quick turnaround on the on our results. Okay.
Maybe we
So
can pause for a few clarifying questions here.
sure.
So how did the workers learn how to use this platform? Did even the control workers learned about this platform being available? And were there so should we expect that
Yeah.
they were aware? Yeah.
Yeah, exactly. So they were indeed aware. So they weren't trained on using the app, but they were aware that the app existed because, of course, as I mentioned, this was kind of like on factory floors. You see a picture of one here, and there was an individual manning the platform. Uh, and so, there was some interest from the control group, in the app or curiosity. As we neared the end of the treatment period, there was quite a bit of expressed interest from workers in using the app. And actually, the long and short of it is this app was extremely popular with workers and with management at the end of the day. And so we actually ended up scaling it up in this factory and are likely scaling it in other factory settings as well. Basically, that does potentially lead to concerns around spillovers, which we obviously took very seriously. I think the ideal design would have been to have kind of separate pods of treated and control workers. This is in effect sort of infeasible unless you do things at the factory level, um, because sort of informal borrowing networks, friends, etc., extend all the way across a factory. It's not just sort of within a particular team. And so, we would have to zoom out to the factory level to cluster there to randomize, to deal with spillover concerns entirely. So, and that was infeasible for this trial. So we decided instead of trying anything in between, which would basically not really limit the concerns around awareness about the app, other types of spillovers, to do things at the individual level to maximize power, um, and then try to measure spillovers head on. Um, I'm going to have a bunch to say about spillovers a bit later in the talk if we can defer that just a little bit. But we, recognize the potential concerns, and we've, some things that give me less stress about the possibility of a spillover, but we're happy to discuss what more we can do to alleviate those concerns.
And what share of your sample might have difficulty using the platform because they cannot read or they've never used a smartphone or something like this?
So actually, I think literacy is extremely high in this setting. I'll show you, I think the, average years of education is somewhere between 8 and 9. These women are about 30 years old. Everybody can read in this setting, but digital and financial literacy may be limited. So, this was, for our scoping, we found that this was often the case that digital financial literacy was, and also access to smartphones was quite limited, and so that led to the sort of decision to have this be kind of a workplace um, kind of SaaS type of interaction as opposed to an individual app that workers can download, which is actually in higher income settings and for white collar workers, that's often how this earned wage access stuff works in the private sector.
Great, thank you.
Thanks. Sowmya or Apoorv, anything to add to my responses?
Yeah, you covered most of it, but also the people, there were support people who will be, who help the workers who could not use the app in the first go. And they were available throughout the study period.
Right, exactly. Perfect. Great. Okay. And yeah, happy to take more questions as we go along. So so let me just tell you a bit about the sample. These were all women. Um, uh, There were, so this was one of the eligibility criteria was ever married, and so about 80% of the sample was married at baseline. They were about 31, 32 years old, on average, about 9 years of completed education. Um, uh, you know, Substantial absenteeism at baseline, which is pretty common for frontline workers, especially in this industry. They were earning about $140 a month. So this is not sort of, extreme poverty levels, but um, individuals are living in, urban contexts where rents and cost of living is quite high. So this is fairly low budget, for the month for these workers. A large fraction of these factories are also, migrant workers who are, sending money home to a large fraction of their money home to their families. Um, so uh, when we look at kind of financial variables, uh, the women, the households of these women, very frequently borrow. So they have, access to credit markets. They borrow quite a lot. So the total borrowing in the last 6 months prior to baseline was about 200 US dollars. And remember, their monthly salary is about 140 US dollars a month. Um, Total savings was similar to that amount, maybe slightly less. Um, about half the sample knew how to withdraw money using a debit card, and about 20% of the sample, or a bit less, knew how to make digital payments on mobile phones, which is um, quite prominent in India, but there's still a lot of sort of implicit exclusion from digital payments infrastructures for people who are not digitally literate and don't have access to a smartphone. Okay, so for most of our regressions here, particularly for survey-related outcomes, we're going to use ANCOVA. And I'm going to skip over these details on kind of the frequency with which workers were surveyed. Some of them were surveyed multiple times. And then for workplace outcomes, we're going to use a panel diff and diff model with individual fixed effects. We use some inverse probability weighting for workplace outcomes to deal with attrition. And at the end, I'm going to show you results on earnings, which actually, and again, kudos to the team here that implemented the study. We got a really high rate, around 96% of women. So even in this high attrition setting, we were able to track almost everybody and ask them questions about their financial lives and earnings and things like that. So, we were able to assess kind of impacts even beyond if these individuals left the place of employment. All right, so some basic stats on the app usage. There were over the course of the year between September 23 to September 24, about a third, a bit more of the women in our treatment group used the app at least once, and 25% had used it more than once in some month. There were more than 700 transactions made. About $12,000 were withdrawn in total. 5.5 transactions were made on average by each potential user in the treatment group, and about $17 were withdrawn on average across users. Of course, as I mentioned, only about a third of the treatment group used the app over the study period, so you would obviously inflate those numbers accordingly. There was fairly strong app usage across the entire month. Across the entire study period. So if you look at the monthly usage rates, the usage rate in the last month was fairly similar to the usage rates in the first couple of months of the study. And we asked individuals at the time that they withdrew, if they'd like to report the reason for withdrawal, and we had various categories. By far the largest reason for withdrawal, and this is actually really resonates with Suprit's work for rural workers, informal workers in India, that a vast majority used their withdrawals to repay loans. And so when these kind of unexpected expenditures came up, they turned to informal borrowing, which was tended to be very costly, or came with social costs if they borrowed from their friends or from family, and they used the early withdrawal access to repay some of those loans. Other larger categories of reasons for withdrawal included expenditure needs for children, for medical expenses, for food, for remittances, and for festivals. Okay, so what are the determinants of app take-up? Turns out that women that have a lower asset index, or proxy for poorer in this sample, are more likely to use the app, and when they do, they use it more frequently. Women who reported more difficulty raising emergency funds and higher levels of financial distress are also more likely to use the app. This is, of course, these variables are all thrown into the same regression. These are sort of conditional, effects here. Women who usually borrow from high interest informal sources like money lenders or self-help groups, they're showing higher rates and frequency of usage. And the app take-up is higher amongst women with very young children, less than 5 years old, which perhaps reflects greater needs and more uncertain consumption streams. So Anna, I'm going to go on unless you just jump in with questions, okay? All right, so let's look at some treatment effects. So the first category here we're going to look at is individual financial outcomes. Women in the treatment group had a 33% reduction in borrowing from informal sources, and a 32% reduction in borrowing from any sources. And this was likely, basically the same because most of the borrowing that they're doing is from informal sources. And this was broadly the same across the high frequency surveys that we did during the study period, and the end line, which asks the same questions at the end of the year period. Sorry. Okay. What happened to kind of borrowing inside versus outside the workplace? Treated women had about similar reductions in the percentage reductions in the rate of borrowing from coworkers versus borrowing from family and friends outside of the workplace. So just splitting out this kind of treatment effect that you saw on informal borrowing in the previous slide. Okay. We also find that women in the treated group are more likely, about 67% more likely, to lend to family members and friends outside the workplace. There's no significant differences in lending to coworkers. So there is less of a reliance on coworkers in terms of borrowing, but not in terms of greater lending. As I mentioned before, and happy to chat about this, and take your ideas as well. Spillovers are obviously a concern here, and we realized this early on. We tried to quantify, what this might look like at baseline and beyond. So it turns out that treatment was given to about, so just to give you a sense of the scope of the issue. So a fraction of the factory was treated. So 16% of factory workers in the factory, which I mentioned had about 2,600 workers total, was actually treated. Of course, double that was in the entire study sample. So one thing to note is, like, since those individuals, there was some kind of inclusion criteria. So it's possible that there's more intensive borrowing or lending within the treated group. But in general, since there's a large sample within the factory, a large population within the factory who are not part of the study, a lot of the interactions that we're going to see are going to be between the treatment group and those kind of 70% of workers who are outside of the study. Over the course of the study period, and we measured this very carefully, 24% of the control group workers borrowed from any coworker in the sample, and 18% of treatment group workers borrowed from any coworker in the sample. So there was a lot of coworker to coworker financial transaction. Among workers who ever borrowed from a coworker, more than 2/3 borrowed from a worker who was not in the study sample. So basically outside of this kind of potential treatment control spillover. Around 5% of workers in the control group and 4% of workers in the treatment group borrowed from a worker in the other group. So the magnitude of this problem is fairly small in the sense that only about 5% of workers happen to borrow from a worker in the other group. Okay, and then there was also, some lending behavior, and those percentages are a little bit higher. Of course, as I mentioned, we can't fully eliminate the possibility, even though those numbers are quite small in terms of the, compared to the rest of the study sample as well as the non-study sample within the factory. Of course, there's the chance that, the fact that there was decreased reliance on coworkers in terms of borrowing might have affected the behavior of the control group, financial outcomes, and other workplace outcomes. So to try to correct for this, what we're currently doing is following the procedure outlined in Borusiak and Hull, and essentially, using our documentation of the financial relationships, both lending and borrowing, between coworkers that we collected at baseline and throughout the course of the study, through a network mapping tool that we developed, to estimate the sort of extent of treatment exposure through networks, and then correct for this in our treatment effects. Okay. So I will, for interest of time, spare you the details of that procedure, but when we do this correction, we essentially find no real differences in the size of the treatment effect or the statistical significance of treatment effects, in line with the fact that a very small fraction of the treated group was, doing financial transactions with people in the control group. So that's that, and happy to hear more discussion about the spillover effects and possibilities to sort of understand them better and purge the treatment effect estimates of them when we chat after the talk. Let's move on to impacts, other impacts from the high frequency surveys. Women in the treated group had a 20% lower likelihood of reducing their usual monthly expenditures due to a shortage of funds. So this, was a set of questions meant to get at something around, consumption smoothing related to shocks. Similar results when we look at the amount of expenditure foregone. And women in the treated group were 31% less likely to report difficulties in making ends meet. We also assessed impacts on spending. Our hypothesis here was actually, could have gone both ways. There could have been an increase in saving as a result of, this early access to funds, because workers who were able to repay their loans more quickly could have saved on those interest costs and put more money into the bank. But it's also possible that workers, withdrew and spent more on discretionary spending or on large purchases or on regretful spending. So overall, we find no impact, no statistically significant effect on, saving outcomes, as well as no substantial changes in regretful spending on unnecessary items. Okay. So, if we divide these kind of financial outcomes over the course of the study period, we find fairly consistent, stable outcomes across the course of the duration of the study. I think that the trend is maybe a slight decline in the magnitude of these coefficients, but there's no statistical evidence of that. Okay. Now moving on to work at three major outcomes here: absenteeism, turnover, and productivity. And then I'm going to show you results on salary, as well as in total earnings as well, independent of whether the individual is at the factory or not. We find first that absenteeism did not change as a result of treatment. So these coefficients are fairly close to zero. They're fairly tightly bound around zero. Absenteeism, I'm showing you, I think this was the weekly means, but this, ever absent during larger periods of time obviously goes up in mean. We still find generally zero effects. Moving on to turnover. Turnover, as I mentioned, was quite high during the study in this population in general, and as reflected by, during the study period as well. So essentially, when we start looking at quit rates per month since the start of the study, we essentially find that treatment effects, start to emerge about 5 or 6 months after the start of the availability of the app on factory floors. By the end of the study period, treated workers were 4.6 percentage points less likely to exit the factory. And this translates into a fairly large percentage reduction in turnover, about a 20% reduction in worker turnover by the end of the study period compared to the control group. This is just showing you, so we had pre-specified looking at heterogeneity across high and low, this is above and below median financial distress at baseline, which was kind of an index created from the, some of the variables described earlier. We don't find any significant differences in the worker turnover across these two groups. Although in general, we find larger effects, if anything, on the group that had lower financial distress at baseline. That group exhibited a larger treatment effect, though not statistically so, on turnover. This was, if you look at the coefficients, it's twice the magnitude in that kind of low financial distress group. We'll come back to that when we're thinking about interpretation at the end. We were also able to assess productivity impacts on the factory floors. This we did through the presence of a so-called hanger system that measured not only line productivity, which is the kind of standard measure of productivity that's used in this setting, but also individual level productivity for every given operation that the worker is doing. And since workers are sort of cycled through lines pretty frequently in this setting, we have essentially sporadic exposure to the hanger system when those workers are sitting on those lines for both the treated and control workers, for a subsample of those workers. And we're going to measure productivity in this setting using this measure called efficiency, which essentially standardizes the productivity of operations that are done, because on garment lines, operations can be very different, and take very different units of time. So somebody who's doing a sleeve attachment, that's a fairly simple or that's a fairly difficult operation. That might take a little bit longer. Somebody who's doing a button attachment, that's a fairly simple operation. That might, you may do many more of those a day. And so there is a global kind of industry standard that allows you to standardize productivity across all of those operations as benchmark to sort of a productivity standard that is determined by the industry and kind of used across the world. So, we're going to look at these as sort of fractions of 100, where 100 would be, efficient as per the global standard. Okay. Obviously, as I mentioned, this sample is a subsample of treated and controlled workers based on when they were sitting on these lines. We look at representativeness and balance. In short, these workers look a little bit different than the full sample from the study, though not very different. But across treated and control workers, there's balance on who shows up in the productivity data. What do we find? Earned wage access increased worker productivity by about 7.5%, which is 4.4 efficiency points. This is quite large, a treatment effect on productivity in this otherwise tightly controlled setting. This is, at the top end of productivity, impacts that we've seen across a whole variety of different interventions we've tried in garment factories over the years. This is also very similar in magnitude to the productivity effects observed in Supreet's study, and speaks to the idea that alleviating some of the financial concerns that workers have reduces their distress and the mental attention that they have to pay to their finances, and allows that attention to be freed up to be used for greater productivity. And 7.5% is, of course, in this setting, huge gains in terms of speed at which these garments are produced, generating, greater revenue for the factory. Okay, when we look at treatment effect heterogeneity here by financial distress, we actually find, that the entire treatment effect is driven, as similar again to Supreet's study, by individuals who had high financial distress at baseline. And so if you look at the magnitudes, this led to a 17% increase in productivity for the group that had high financial distress at baseline. For those with low financial distress at baseline, the productivity effects are effectively zero. And so this underscores the mechanism I just described, that those with high stress are devoting a large kind of amount of cognitive energy towards worry about their finances, and alleviating some of that results in a fairly large improvement in productivity in the workplace. Okay, finally, when we go to earnings, when we had of course, by the end of the factory, by the end of the observation period, we had many workers attrit from the factory. We both look at inverse probability weighted estimates on salary within the factory, as well as look at overall earnings, as reported in tracking surveys that track down 96% of study participants, which kind of reduces the concern for selective attrition. What we find is that there's no significant effects of treatment on factory earnings, and this is likely due to a few factors. First, there's no effect on absenteeism that we see. So often absenteeism is the sort of mediator for earnings impacts on the factory floor, because you only get paid for days that you show up. And so if you can show up more days, that means you get paid more. That doesn't seem to be a margin that this intervention changes, and so we're not finding changes in total earnings because of that. Base wages adjust slowly, and only through promotion to higher skill grades. And so, that's fairly infrequent, and we don't find that here. And finally, performance pay, which we think might move because people are much more productive, especially those with high financial stress at baseline, is in these factories determined at the line level, so the team level, as opposed to the individual level. So even though individuals are more productive, that may not translate, because of the sparse treatment on factory floors, to a treatment effect at the line level. And anyway, we didn't stratify at the line level, et cetera, for treatment exposure. So we are unable to capture those effects. You might imagine that if you scaled this across the factory, that if you improve the productivity of everybody on the line, that this would then translate into performance pay increases as well. But we don't find that in our sample, that given the study design. Finally, related to earnings, we find that there's an increase in total earnings of about 12%. And this is mainly due to the fact that when women workers quit in this study sample, most of them, almost all of them, were not taking up employment elsewhere during the tracking period. So essentially, the margin was I work at this factory or I quit and I'm at home. I'm not currently working at all. And so then when you ask about earnings, informal or otherwise, those individuals are earning zero or close to zero. And so, formal retaining women in formal employment and the turnover effects, as I described, were quite large, about 20% reduction in turnover. That's what actually generated the earnings differences that we see on average across the treated and control groups.
Actually, I lost a bit of track of time. Would you be able to wrap up soon so we can move on to live Q&A?
Perfect. Okay, so let me actually do, that's actually the last sort of major result that I want to go over. There are these impacts. So, effectively, we don't really see impacts on measures of women's empowerment, self-efficacy. We see a little bit around, financial related self-efficacy. But across the board, there's a bit of noise there. So let me stop there and move to questions so that we can, have a discussion, and happy to kind of continue on the results front if we need to. Thanks a lot, everybody, for tuning in, and I look forward to your questions and suggestions. Should I stop share and then so we can see everybody, or?
I think you can leave the slides. If anyone has questions, they can raise their hand. So Malika has a
Okay.
question.
Go ahead. Sorry, I'm going to just go back to the results snapshot. Okay.
Okay, Malika, please go ahead.
You need to unmute yourself, Malika, but you can ask the question live if you want.
By the way,
sorry.
Okay, go ahead.
Okay. So the first thing I just want to say that it's a kudos to Shahi to host your pilot. Second thing is the concept is so great, looking at a good percentage, like 37% of reduction in borrowing by the treatment group workers and the increase in 17% productivity. So that is also a good one. And the third thing that I liked was I'm so proud that India has these many workers, enough literate to use such app, and many who even have phones. So that's a good part of it. The treatment pool. Eventually, the factories may have more tablet stations available to access the app, even at the factory, and at that less use of their phone and data usage will be, because there is a lot of people are concerned more over their data usage too. So if something is available in the factory, I think that will happen. Some more stations will be there. But I just have one question, and a very simple question, that basic, that I'm a non-economics person, is that was there any request from the users to make the app simpler during the treatment period? And was it more in the beginning, obviously, or later?
Okay, thank you. And as you might have seen from the name over there, this is my dad. So hello, Dad.
Mom is here too.
Um, that's kind of you to attend. We actually, I think Sowmya can probably get this, but yeah, I think we actually, designed the app to be as simple as possible. We also had somebody, standing with the tablet to be able to walk workers through at any point during the day. So that was sort of staff on hand to provide the service of walking you through and making sure that you were actually able to withdraw.
No. Thank you.
Thanks.
Thanks. I think Cynthia also has a question.
Yeah, hi, can you hear me?
Yeah.
Yes.
Great. I had a question about, this is super interesting. I had a question about the last result that you presented about the effects on kind of turnover and retention. And I was wondering if you have a sense that is that coming from maybe an idea that in the absence of this amenity, these jobs were kind of just barely meeting workers' participation constraints, and that's why we see reductions in turnover? Or do you think that's coming from a reduction in kind of undesired separations where, maybe I can take this advance and use it to hire a babysitter for my child so I don't have to quit work when my child is sick or something like that? I just wondered if you had any thoughts about the mechanisms behind that.
Yeah. No, that's a good question. I think we need to delve into that more. I was hoping for, um, more significant differences across the two baseline financial stress categories. But what we had in mind was the former, that basically this is about um, the fact that women were essentially just meeting their participation constraint, and for some women, this sort of the amenity, the option value of withdrawing kind of nudged them over, to stick around at the firm. Um, for the high financial stress category, those women tend to be poorer, and so those, reservation wages may be lower. So, I think that's why we don't see impacts on that margin for the high financial stress folks. Giacomo,
Yeah, it's great to see you. Thanks so much.
nice to see you too.
Well, so I was wondering about suppose you scale up to the entire factory, and it's not about spillover, it's about how financially viable this is for the firm, right? So the cash flow is going to become a little more complicated because, of course, if everyone withdraws, then the cash flow management of the firm has to be very different. Have you given a thought about that? Because the results are amazing, right? Because you think, well, let's roll it
Yeah.
out.
No, exactly. Right. So it's a good question. And we hope to scale, this technology so that it affects as many workers as possible, positively. We are currently piloting this scale, within the same factory. So we scaled it to all the control group and the non-study participants. And we're seeing what happens there. I do think that cash flow is a problem, and that's why a lot of the the other in the private sector, there are companies that do this, for example, in the US, usually with kind of corporate workers, etc. And they do this through apps that have kind of third-party financing. So they essentially will have their own kind of um, you know credit or various financial structures to draw down funding, and then they square it with the firm, on the back end at the end of the month. And I think that tends to work well, but involves, using an individual app, which would, greatly limit usage. And actually, it turns out that another Shahi factory recently tried one of these that's app-based, and over the course of something like 6 months, the total usage was less than 1%. So almost nobody used the thing because it was, basically inaccessible to many workers who are not digitally financially literate, can't download their app, can't connect to their bank account, all that kind of stuff. So I actually think, this approach has more viability, but does involve a lot of cash flow changes. So it's an open question how you resolve that the potential for like aggregate shocks resulting in mass withdrawals. That seems like someplace the government can step in,
Great. I'd like to do one more question by Sifat, and then we have to end.
Perfect.
Hi. Firstly, congratulations. I think this is a great study. I just wanted to ask about productivity. You mentioned that you have estimated individual productivity, but since we know garment manufacturing has to do a lot with collective work of the workers in a line of, say, 40 or 30 plus workers. So would it be a thing in the future that we need to see how the EWA impacts spillover effects of productivity? Perhaps something on this if you want to say, enlighten us on this. Thank you.
Yeah, no, of course. And I think, this is an open question in the sense that it's really, unclear to me which way, those productivity effects would go. It seems that only a certain part of the sample, these high financial distress, individuals are the ones who are able to, expand their productivity as a result of the intervention. How many of those, so I guess if we apply that across, the entire factory, we may expect that half of the factory sample, it would fall into that category. Roughly speaking, we had eligibility criteria and whatnot, but ignoring those, would we see impacts on productivity overall if say half the sample's productivity increased? I think we would, because at the line level, that's a lot of individuals whose productivity is going up. So my hypothesis is yes, but unfortunately, we're not doing a factory level trial on this. Because we only have a certain amount of relationship capital with the firm. But we are, hoping to scale and just observe changes in productivity before and after, the pilot across the entire factory. So we'll hopefully see some evidence of that.
Thank you very much for the talk, Ach.
Thank you.
Yeah, we will meet again in 2 weeks for another exciting talk. And then for all the other questions for Ach and co-authors, please meet us in the other Zoom chat posted. Thank you very much.
Thanks, everybody. Appreciate you attending. Bye.
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 Thank you. Bye.